Hello and welcome to the second tutorial in our More Than Skin Deep anatomy series. My name is Adiolu, and for this tutorial I will be discussing the anatomy of the heart. I will start off with a clinical scenario of a heart pathology, then take a deeper look at the anatomy of the heart and its vasculature, before returning to apply this anatomy to the clinical case. First, I would like to make a quick disclaimer that Medsoc and SurgSoc take no personal liability for any inaccuracies within this presentation. Students are advised to check their course learning objectives for further details. All images in this presentation are original or referenced at the end. The learning objectives of this podcast are to appreciate the location and anatomical relations of the heart, to identify key external features of the heart, to understand the flow of blood through the internal anatomy of the heart, to understand the vasculature of the heart, and to appreciate the anatomy of catheter procedures and interventions of the heart. Now let's examine the case. This is Anna. Anna is a 55-year-old woman, and she has recently started noticing some symptoms during her regular afternoon walks. Anna's symptoms include chest tightness while walking, dizziness while walking, and shortness of breath while walking. Anna presents to her GP, who refers her to a cardiology consultant. She has an echocardiogram done and is diagnosed with aortic stenosis. Anna is then booked for a TAVI, which stands for a Transcatheter Aortic Valve Implantation procedure. Let's take a closer look at the anatomy of the heart. So this is a photo of the anterior aspect of the heart. The heart is comprised of 4 chambers. It is located in the mediastinum of the thorax. The mediastinum is the central part of the thorax between the 2 pleural cavities. The 4 chambers of the heart include the right atria, the right ventricle, the left atria, and the left ventricle. Next, the circulation of the heart. Deoxygenated blood from the body enters the superior and inferior vena cava. From the superior and inferior vena cava, blood is pumped into the right atrium. After the right atrium, blood then flows into the right ventricle. From the right ventricle, blood flows through the pulmonary artery into the lungs for oxygenation. Oxygenated blood then flows from the lungs through the 4 pulmonary veins into the left atrium. Blood then flows from the left atrium into the left ventricle and out the aorta to the body. Your heart has structures called valves that ensure that blood only flows in one direction. You have 2 valves between your atria and your ventricles called your atrioventricular valves. Your right atrioventricular valve is your tricuspid valve, and your left atrioventricular valve is your mitral valve. You also have 2 valves that separate your ventricles from your great arteries that arise from them. Your pulmonary valve separates your right ventricle from your pulmonary artery, and your aortic valve separates your left ventricle from your aorta. All of these valves are comprised of connective tissue. They all usually have 3 leaflets, except for the mitral valve, which only has 2 leaflets. Your heart is supplied by your right and left coronary arteries, which arise from the root of the aorta at the aortic sinus. These arteries are the first branch of the aorta before it gives off the brachiocephalic trunk, left common carotid, and left subclavian arteries. Your right coronary has a longer stem, curving around your tricuspid annulus and giving off your marginal branch anteriorly. Your left coronary has a short stem before dividing into the left circumflex and left anterior descending arteries. Posteriorly, you can see the posterior descending artery branch off the right coronary artery. This occurs in 85% of the population. In around 10% of people, both the anterior descending artery and posterior descending artery branch off of the left coronary artery. This is classified as a left dominant heart. Having a left dominant heart can increase the severity of a myocardial infarction. The venous drainage of your heart drains from the great, middle, and small cardiac veins into the coronary sinus. The coronary sinus then empties into your right atrium. Now let's return to the case. With age, valves can narrow and become stenosed. This means that less blood can flow through the valve than in a healthy heart. Less blood flowing into the aorta means less blood flowing into the coronary arteries which supply the heart tissue. This is why Anna had chest pain. Less blood flowing into the aorta also means less blood flowing through the carotid arteries to the head. This lack of blood can cause dizziness. Lastly, less blood flowing through the aorta means the heart has to work harder to supply the body with oxygenated blood. This can cause shortness of breath. Sometimes to treat an aortic valve, you need an open heart operation. But in some cases, you can fix the aortic valve through a catheter procedure. This procedure is known as a transcatheter aortic implantation. In this procedure, a catheter is commonly placed through your femoral artery, which then travels up the aorta to the aortic arch. From there, an artificial valve is implanted at the location of the formerly stenosed aortic valve. Now let's recap the importance of anatomy. Anatomy is important because it helps you understand the circulation of the heart and what chambers the blood flows through when circulating the heart to the lungs and then to the body. It also helps you understand the valves of the heart and how those valves can change in pathology like aortic stenosis. Understanding the vasculature of the heart is important as it helps you appreciate how the coronary arteries arise from the aortic sinus and supply the heart with oxygenated blood. These are the references used during this presentation. Thank you for listening. Please check out our handout in the description box below for a summary of everything we talked about, alongside extra information and questions to help with your revision. If you enjoyed this tutorial, please remember to like the video and subscribe to our channel. If you want to see more videos like this, then please check out the rest of our YouTube playlist, or visit our website at bhamsurgsoc.com/anatomy. Thank you for listening.